I'm Dr. Randolph Lopez. I'm one of the many hand surgeons here at the Hand Center, based in Houston, Texas. We had the privilege of being informed of Moses' plight here in the operating room when someone showed me a picture and said, "Hey, can you help this young boy?" And we looked at it and we said, of course, in typical surgeon fashion, yeah, of course we can. The more we found out about it, that we realized that it was going to be a difficult trip for him to get here. From our standpoint, I've enlisted the help of all of the team of doctors here. And those involve hand surgeons and orthopedic surgeons who are involved in upper extremity and lower extremity. Everyone, as soon as they heard about him, was interested in helping out. So I think he may be quite surprised to find about 6 or 7 doctors just waiting for him to come in the door to see what we can do. Obviously, it's difficult to see exactly what the problem is. We could see from his photos that obviously he has a problem with his left arm, and with the difficulty of making the quote 1,000-mile diagnosis, we think that we can provide some improvement depending on what he has. We are aware of his injury and what the circumstances around that were, but from our standpoint, we'd like to see what he can do now, and we're going to ask him what we can do to make his life better. The small thing here is the surgery. This is something that we do on a daily basis, and we like to do it, and we expect good results. I think the big thing in this regard is how he is going to get here to the United States to get the care that he needs. I think it's wonderful that he has a group that cares about him. I think he has a group that prays very hard for him. I think that is the bigger story. I think the surgery is the small thing that we're going to do, and we'll do something and we'll get him back. But I think the most important thing is that he has a group of people who care about him, who pray for him, and who are doing this in the name of God, which I think is the most admirable thing. And everything that we do here is sort of his work through our hands. So we're very humbled with the results. We're very pleased with our results, and I really pray, and I think all the doctors here pray, that we're going to give him the best results that he can possibly get. I think everyone has to understand that it's a group effort, and just like the congregation is going to all come together to help this one boy, well, the Hand Center team is going to come together on our aspect. It's not me. I may be the person in front of the camera who's speaking on a big screen, but it's Dr. Corsandi, it's Dr. Norbai, it's Dr. Lee, it's Dr. Harper. Everyone is involved with providing care. Dr. Dang is going to be involved with doing nerve studies to make sure that he's okay. Dr. Guyden is also going to be involved with that. The care at the Hand Center, and as well as at St. Michael's Surgery Center, is also going to be a big component. So there are a lot of people involved with this care, and we just like to say from all of us at the Hand Center, thank you for allowing our family to help your family.